My name is Dr. Adra Edu. I serve with Edify as the program lead for the education department, and I'll be moderating this session. The topic for the session is students' mental and emotional health needs during the new era of learning. You would agree with me that the COVID-19 pandemic has catapulted mental and emotional health to the top of the global agenda. So as educators and school leaders, it has become very important to pay attention to our own mental and emotional health needs and that of the students we serve. This morning we are blessed with three distinguished professionals who are pleased to delve into their rich experiences, knowledge and expertise to offer varied perspectives on this topic. First on the panel is Dr. Gaisie. Dr. Gaisie is a child development expert and a physician at the Efiam-Kwanta Regional Hospital in the Western region of Ghana. You are welcome, Doc. The second panelist is Dr. Cecilia Tutu-Danquah. An educator herself, Dr. Tutu-Danquah is the founder and leader of the Tusi Group of companies. She is a founding member and the current national president of the Ghana National Association of Certificated Counselors. She is currently the supervisor of Jackson College of Education and a lecturer at the University of Ghana, Legon. Our last and certainly not the least panelist is Dr. Mabel Oti-Boadi. Dr. Oti-Boadi is a clinical psychologist, a lecturer and a research fellow at the Center for Suicide and Violence Research with the Department of Psychology in the University of Ghana, Legon. She's also a research fellow with the Fox International Fellowship at Yale University in the United States of America. Dr. Oti-Boadi is a philanthropist with a passion to promote the welfare and mental health of the vulnerable. Thank you so much for making time to join us discuss this very important and crucial topic. Okay, so let's start with you, Dr. Tutu-Danquah. What should school leaders or educators know about the psychological impact of the COVID-19 pandemic on schools? Why is this such an important item to discuss, especially around this time?
We also show some level of change in their cognition, the way they learn. Why? Because some have gone to stay in the house and are even not learning. So their interest to learn will go down. And it's also part of the psychological issues because learning emanates from our psychic mind. So we need to also expect that these things are going to happen. Good. Now, aside that, we should also watch the teachers, the non-teaching staffs. Those are the kitchen and all that. They are also coming up with different behaviors. So we should also pay particular attention to them and put down interventions that will maximize their productivity. If you were a teacher or if you were a school leader and you were giving them school, food services, you should be ready to know that now some of the students wouldn't even want to eat your food. Mm-hmm. Their parents will tell them not to eat. They are scared of their lives because they wouldn't know who is coming to cook for them. So the little income that you even be getting from the feeding may also go down. So we also need to look at this very careful and then put down measures. Let the students be aware that, oh yes, we have screened them, they are all okay, so that they'll be stable enough. The next thing we should also expect and put down issue is the tutors. Already some are frustrated and you know, they've been at home for some time now without salaries. Yeah. And that alone, psychologically, some of them will be bitter. Mm-hmm. So when they come back to school, they may not be as lovely as they used to be. Yeah. And this kind of attitude, they may expose that in the classrooms, and it may affect the student-tutor relationship in school. So we need to check on that one. All these are some of the issues that we need to expect as part of the psychological issues that both students, tutors, and non-teaching staffs are going to go through.
Thank you. Thank you so much, Doc. So, Dr. Gaisie, we want to hear your perspective on that.
I was really enjoying Auntie Cecilia's submission on the matter. So what are children going through at this moment? They're out of school and they are hearing a lot about physical or social distancing. And so they are not going to church, they are not going out like before, and all that. They are being encouraged to also stick to the precautionary measures and all that. Now, human beings, we are very interactive. We are born to be social. That alone is sending signals to them that we are coming to a point where we may end up losing our humanity, because this has a potential to make us become inward looking and not outward looking. So the physical distancing is having some impact on them. And you find out that these impacts actually cross to the emotional and to the mental bit of it, because there's no line dividing this as psychological and this as mental. Okay, so the physical distancing, then there's also digital distancing at this time, because some people may want to get online with their friends and all that, but their parents will not be able to afford data for them to keep up the way we would have loved to. And that comes to the issue of economic stress. I'll talk about it because Auntie Cecilia has already mentioned a bit about economic stress. People have lost their jobs, business is not booming as before. And so even that alone is creating some kind of friction in families and among parents who are not able to adjust well, cope well. There'll be some sort of dysfunction in their families, and the child is there. Most children in this period will suffer some kind of abuse, physical abuse and verbal abuse. So children are going through all these things, and what it will take is for parents and teachers, caregivers, to be aware of what we are in, so that they'll know how to conduct themselves. Okay. Then some children will also be at risk of being sexually abused. And as a physician working with children, I've seen not less than 3 cases. Sexual abuse is already under-reported. And we've seen some between March and now already. So sexual abuse also is there. And then all the risk of being on the internet, cyberbullying, addiction to social media, all these are going to pose mental health problems, especially depression when it comes to social media issues. And there's a lot of bullying going on. If you put something there and you don't get a like, it has an impact on you. You don't want social media to create your child's identity for them. Now, sitting behind the computer for long hours also is going to create problems for them, physical, because with regard to their physical health, because it's a bit sedentary. So, in fact, this topic is very important, and I don't want to drag it, but I just wanted to situate what children are in at this moment, so that we'll all be on the same page.
So, we can say that the mental well-being of children at this time has been greatly reduced, and amongst them, many students believe that they are not going to be able to continue. They may fail with their educational progress and so on. And just like adults, children also have a fear of contracting the condition, fear of dying, losing their parents, and so on. So they're also going through the same thing. And so school is very essential. And now that school is not in place, children are going through a lot of problems. So we need to recognize that there's a serious problem at hand at this time when we have this pandemic, and it's going to change people, or it has changed people, and it will change people forever. Now, what I can say with children, especially, children up to adolescents, is that there are certain things we should look out for in terms of the some warning signs of what they'll be showing as serious emotional problems. We can see that they are emotionally withdrawn. Some of them may be eating and sleeping too much or too little, and having some kind of irritable mood all the time. They don't want to engage in activities they used to love, and so on. So you should look out for some of these things. But studies are showing that there's actually a link between mental health and academic achievement. What we have seen going on in this past months, showing that there is some kind of problems with people's ability to adapt to what is going on, especially with students. And this connection between their mental health and academic achievement has been found with the fact that we have several changes in terms of physical and chemical changes to the brain when we are exposed to stress. And now that many of them are exposed to stress, there are deficiencies in thinking, there are deficiencies in concentration, memory, and creativity. And this greatly affects children. Teachers are not left out because teaching is a very demanding profession. Even before the COVID-19, studies showed that about 55% of teachers believe that their workplace poses serious negative impact on their mental health. So now that there is this pandemic in place, more than ever, we need to support teachers. Recently, there was a study done by the Yale Center for Emotional Intelligence, drawing about 5,000 teachers, and many of them reported that they were going through anxiety, depression, worry, and they were very confused. And since teachers play a very crucial role in students' learning, listening to their needs and supporting them in this particular time is very important and very pivotal for their success, that is during and then after the crisis. Thank you.
Thank you so much. So, Dr. Tutu-Danquah, let me come back to you. Listening to all of you, is there a way out? What can educators do? What can school leaders do to help themselves, their teachers, and the students, and possibly parents? Because now the children are at home, so parents are playing the role of the educators and parents as well. So let's see what can be done.
Okay, thank you. Now, first of all, we need to provide a form of counseling services to all stakeholders in education. That's tutors, students, parents, non-teaching staff, the proprietors themselves also need it. So this is the time that we need to intensify the counseling services for these people. So for instance, if it's so happens that schools are resuming, coming back, then the first day that the students will come, there should be a counselor in the school to meet them and give them one-on-one counseling or group counseling, depending on their age-appropriate counseling, to get them well integrated back to school. That is very important. Now, the next, the way forward out is also to make sure that we adhere to all the protocols, because these students have been observing the protocols at home and wherever they follow their parents. So if they come to the school and then you don't give them that protocol, you are going to lose your students. We need to have PTA meetings that to give assurance to parents that their children will be taken care of. For this particular PTA meeting, I wish we would not talk so much about the fees, at least for the first day. Let's talk about assurance that their children will be fine. Now, when people are well assured in their mental state that everything is going to be well, things are going to be better, they are able to do everything.
Dr. Oti-Boadi, what are the step-by-step psychological systems that educators can put in place to address this, especially for teachers and students?
Okay, thank you very much. Like I said early on, no one is more, prepared in terms of wanting children to get back to school than parents and educators. But how do they get back to school? In a safe environment. So I think that it shouldn't just be about catching up. We should catch up. We lost somewhere. It should be about safe reopening. What should we put in place to ensure that our children are safe and our teachers are safe? That should be what should drive the discussion. And we should be informed by the data available in terms of transmission in the community, in terms of what's happening now. When the pandemic began, there were issues of, it couldn't be transmitted through the air and you need a close contact and so on. Now there are changes. So information should be something that you should be given all the time. Teachers, educators should always coordinate with the health professionals to know what to actually do, to put in place in terms of isolation centers, in terms of where to site this and that, and provide that information for parents as well. Again, educators should ensure that these strategies in terms of the protocols are being adhered to if we want to go back to school, as in the hand washing, social distancing, making sure that you use places that you didn't used to use in your school. You can use them now as classrooms and all that to be able to space out. And then what I can also say is that when it comes to other activities that were occurring before the pandemic, like sporting activities, drama, singing, and all that, now we know that there's a pandemic in place. So those things should put them in the background. What are you going to do in place of those? Those things that will not make social distancing feasible. You should look at all those things and ensure that the right communication channels are open between the schools and the parents and then teachers as well.
So how can educators ensure that stigmatization is reduced or perhaps zeroed on the campuses when school reopens? So Dr. Oti, yeah, I want to.
Come in?
Yes.
Okay, so stigma has been on the drawing board since this whole thing began. And it's a very serious issue. And I can say it's something that is natural with people. When people see themselves as different from others, they tend to stigmatize, they discriminate against them. So what we can do is to share information. That's one basic thing we can do, is to share information. Most of the time, stigma thrives on rumors, uncertainty. These people brought the disease. It is about these people. They didn't take good care. That is why some people said, they went to chew this meat and so on. But it's important that educators would share the right information as to where we got this from, what we can do to keep it at its barest minimum. If we are able to do that for our students, then even when they find out that somebody has gotten their condition or they are going to go back to school and then somebody has it, they would not shun away from that person, because they know that even when the person gets it, something can be done about it. Like we said, there should be some kind of reassurance that this is not the end of the world when somebody gets it. And then even with children, we haven't seen that much in children. So you should be able to explain these things to them. And then be a model, teachers, educators of compassion. Children learn a lot through observation. So when they see that you are showing that kind of compassion towards other people who may have had the condition and all that, they would also learn that we don't need to shun people because they have gotten this condition. And even when people have recovered, people still want to shun them, want to discriminate because they have gotten the condition before. But when you're a model of compassion, they will learn from you. And then I heard one of us talk about bullying. Yes. Okay. It would occur. It exists, and it would continue when school reopens, even in the face of this pandemic. So we should be concerned about bullying and how to ensure that students are staying away from this, and then explore their fears.
Thank you. Dr. Tutu-Danquah, you made mention of the need for schools to have counseling services. We are still talking about the way out, what educators can do. So in addition to the counseling, in Ghana, are there mental health facilities that schools can be linked to? For example, if you have COVID, you know you are going to this and this hospital. But if there's an issue of mental or emotional health challenge at any school, are there outlets or facilities in Ghana that can be accessed by the schools?
Oh yes, we have outlets. Now, the Ghana National Association of Certificated Counselors, we have our COVID-19 team, and our numbers are in circulation since we went on the lockdown. So we can make it available to the schools. We have 4 zones in all the regions. We've zoned it into 4. So if they're able to contact us, we will be able to link them. And even if it's outside Ghana, you still want, we've come on board with cyber counseling. So there's an app that the association has developed in collaboration with TUC, we call iCounsel GH, which will be on phone. So what you need is to go through and identify a counselor that you want to talk to, and you'll be, let's say, yes. So iCounsel GH is there. God willing, we are now on the testing, and it will be launched, God willing, in October. So it's also available. As we wait for that app to formally come out, our numbers are available. So even if you call my personal number, depending on where you are, we can give it to the team, and then they will attend to you. Aside that, Ghana Psychology Association also have their numbers, it's also shared, and they are also available. We work together. I know they are present as well. So depending on where you are, we can also link up. And then we have other private institutions, like TUC Council Organization. We have a counseling team that if you so deem that you want to, you can. There are other practitioners in the system. And you know that counseling and psychology implementation hasn't been so hailed in Ghana. But at least for now, we are getting to the point where people have seen the need for psychological support. So we say that a counselor is just a phone call away from you. You don't need to come face to face, and we are there to support.
So like I mentioned, when you have COVID, you know you have COVID, you are going to the hospital. But at your facility, has there been any record of students, children, or anybody reporting with mental or emotional health challenges? Okay.
Yes, we've got children tested positive. But as to whether we've had COVID-19 mental health related issues, it's really been with pregnant women who were rejected before delivery by their family, by the community. We've seen a lot of that, but not in the cases of children. But I'd like to comment on the previous issues that you raised concerning what we can do, what is expected of us. And I like the fact that Dr. Mabel said that you need a good mental health to perform academically. It is also true that a lot of adults who have mental health disorders actually had some childhood experiences that were not really managed well. And so the mental health pandemic that we are talking about now is not even about today or next year. It's about the kind of adults that we are going to become in the next 10 years, the next 20 years, if we don't intervene. So she's already talked about recognizing the symptoms and the features and the characteristics that the children will show is important. So parents and teachers must actually know what to look out for. And if you contact the Ghana Psychological Association, they'll help you so that when you can look out for these things in children, so you can help them now, because a lot of adults, mental health disorders actually started from childhood. And so the first thing is we have to help ourselves as adults, and then we can help the children. That is what will make the difference. I would say that all of these challenges are actually opportunities. They are great opportunities that we can take advantage of. For instance, the disruption to normal life. We can use this as the occasion to build resiliency and strengthen the problem-solving skills of the children. And Dr. Cecilia mentioned that we have to involve the children. That's very important. Participation, peer-to-peer learning. It works better than when we adults try to come in and teach them precaution measures and all that. If their friends know it and they are teaching them, they learn it better. So how do we build resiliency? How do we make the children tougher for life? Because this is one out of many pandemics that are going to come. We can do that through all the things that we've already mentioned, including even making age-appropriate posters in the school, age-appropriate flyers, regularly educating and talking about these things. Now, the issue of fear and anxiety, we can also use that as an opportunity to teach them the skills that they need to learn on how to manage stress and their emotions. Because there are a few things that they can do to manage stress and emotions. I mean, it includes even relaxation techniques, like taking very deep breaths. It has a very positive impact on the brain. So all these challenges, we must turn them into opportunities for the children to learn. It's a learning experience.
Dr. Oti-Boadi, you and Dr. Tutu-Danquah, any of you can pick this up. There's a question from our viewers. It says, aside a learner being stigmatized by a friend in school for contracting the disease, what can we do to help the child who has recovered from it not to feel less of a person? It looks like you mentioned something about it, but since it has come up again, can you help us?
Social stigma, that is associated with these connections with people who are different, people who have diseases and so on, actually can also occur. I mean, children can also experience this, but when they do, you have to be a model. As an adult, you should be a model of compassion. Let them know that once you have been able to come out of this condition, you are a champion. You are not like a thing or a case or whatever. Let them know that they have gone through some kind of battle and they have come out successfully. And so they have to believe in themselves and be happy that some people have died, some people are still in the hospitals, but they are out. So you should let them know that everybody should be treated with respect. Everybody should be treated with comfort. Everybody should be accepted. So if somebody doesn't accept them, that should not be their problem. I said, speak to them, let them know, let them have it in their minds that this is not what I should go with. What I should go with is that I am a winner. I have won this battle and I'm going to help others win. by respecting others, by being there for them, by showing respect to others. When you do that, that child will know. So like I said, we should be models for the children to observe. Yeah. So that child will know that for me, I have been able to come out well, and so I'm going to do this for other people. But when we don't do that, and we just behave anyhow, the children will also observe us and also behave anyhow. So we should let it sink in their minds that COVID-19, yes, it has come, but once I have gotten it and have recovered, I'm good to go. I'm also going to help so that other people will feel more comfortable and they'll feel accepted.
Great. Thank you so much. So our cherished viewers, very soon you'll see questions popping on your screen. Kindly take time, when you see the questions pop, take time and answer the questions for us. Thank you so much. All right, so Dr. Tutu-Danquah, I come back to you.
Yes.
Yeah. So sorry. You have your question here. So, how can educators? Yeah. How can educators offer excellent online or remote education that does not support only learning but also the psychological or the psychosocial well-being of students?
Okay, thank you.
All right.
Now, the first one is to show love
Great.
to these students. And showing love does not necessarily mean you should be present. So it could be online. Some love quotes, assurance, like compassion. I mean, everything that you can communicate through the virtual platform to make the students feel that despite what is happening, they are still loved, they are valued, they are accepted. Please, let's do that.
Great. Our time is running out, so I would ask that each of you share your final message, bearing in mind the need for educators to implement or set up systems that would help students improve their mental and emotional health.
So we need to explain to the children how new this normal is. And we have to try to adapt to this new normal. So we have to go back to basics. What are the basics? One, the children need to have enough sleep. Okay, they need to have enough sleep. So the times when children are waking up at 9 and 11 and all that, we have to try to get parents to start sort of restricting them so that they can just get enough sleep and not oversleep. Otherwise, it's going to be difficult to get them back when they need to go to school early and all that. That's one. Now, a lot of them are also getting addicted to their mobile phones, getting addicted to social media. The impact of social media is very gross. You cannot overestimate it. We have to ask ourselves, why is it that when somebody comes to say, oh, I'm drinking Calipo, and everybody starts drinking Calipo and puts it on the internet as a Calipo challenge? It's because they're looking for identity. And we don't have to forget that all these children have age-appropriate needs. Okay, children between 5 years to 10 years, they are developing initiative, they are developing their leadership capacities. From 10 years going to 20 years, they are developing their identity, their self-esteem. So in the context of helping them with their mental health needs, we also have to look at how we can meet these needs. And I'm happy somebody talked about that we hadn't mentioned the God factor. Yes. So one of the coping ways of coping is actually letting the children now memorize scriptures that are relevant to the times, teaching them songs that are relevant to the times, and letting them see how big God is in all this. Okay, there are so many testimonies that we can talk about, and even letting them open their eyes to even see how God has been good to us. Let's talk about the recoveries, the positive things going on, and not just allow them to be exposed to unnecessary news. Okay, so now the first thing is sleep. The second thing is, I was talking about social media impact. The third thing is diet. You know that they have to be eating healthy. So what are we going to do? Are the schools going to provide food? Are their parents going to provide food? All these are things that will actually also help them be mentally healthy. because you need a sound brain in a sound body. Then I've talked about schedules. It's good that you have schedules, but it should be flexible. And the last thing is about child protection. Let's be aware that a lot of predators online and predators at home. Let's not allow the children to be sexually abused. Please, this one really matters to me, because the moment the child is sexually abused, it changes the whole developmental trajectory. Okay, it has lifelong consequences, and we ourselves too, we should be careful that we empathize with the children. Let's not dismiss them, and let's not abuse them also. This is a time, like Dr. Celia said, to show them a lot of love and compassion.
All right.
So that is what I want to add to all that we have said.
Thank you so much. So in 1 minute, Dr. Tutu-Danquah, would you give your final comments?
Okay, thank you. I'm giving my final word by giving you an acronym, which is aspire. You have to aspire. The A is that we need to accept that COVID-19 has come to stay. So whether you're a student, you're a tutor, you're a writer, you are participating in this conference, we need to know that it has come to stay. That is the A, acceptance. Don't deny because it is real. Now the S is that speak out. Whatever the problem is, don't hide in there. Don't let your emotions kill you. Speak out. Speak to someone about how you are feeling. Speak to a doctor, speak to a counselor, speak to a God-fearing person, and then come out of whatever is torturing you so that you can enjoy life. Now the P is that pray, pray, pray. You have to pray about every situation that torments you in this pandemic, because God is above everything, and that is the P. The I is that we should be very innovative as teachers, as proprietors, as individuals. COVID-19 has come. What are you coming up? What innovative ways are you using to overcome this? Be innovative. Think. There are so many potentials in you, in the children, in the teachers. Involve them. Let your school be a new school that is ready to accept this pandemic, and that is innovation. The R is that recreate, because COVID-19 has come to destroy a lot of things. Let's go back and recreate. Be happy. Don't worry, be happy. We are above COVID-19. So create calm moment for yourself. If you're an adult, just move out, be refreshed, because we are refreshing and moving forward to the glory of God. And then the E is that get educated, get enlightened about COVID-19. Don't hide in primitive knowledge. Get the right information, educate yourself, educate your community, educate your students, and that is aspire, and we shall overcome in Jesus' name.
Amen.
Thank you so much.
Hallelujah. Thank you. So, Dr. Oti-Boadi, your last comments.
Okay, thank you so much for this helpful webinar. What I would say is that we have now seen the effects of this pandemic on students, teachers, and educators. And then we have seen that they are going through so much in terms of their anxieties, depression, and so on. But we need to let everyone know that we should live one day at a time. We shouldn't be thinking about the future. We should be in the present and enjoy what we have now. One thing we should know is that people are naturally resilient. You know, we are adaptive, we can adapt to situations. So we should encourage people in these times, and then go by these 5 steps I'm going to provide educators as we prepare to reopen schools. We should focus on the sense of safety first, and then calmness. We should be calm, and then when we are calm, our students would also be calm, and then there should be that connection between students, educators, teachers, and parents. There should be that connection, and self and community efficacy. What is going on in the environment? What can we do? And what are we able to do to deal with the COVID-19 pandemic? And then we should talk about hope. There is hope. When this whole thing began, we didn't think we would be here. Lots of people talked about the fact that many people are going to die on the streets and all that. But remember that those things didn't materialize, didn't happen. So it means that there's so much hope we have as a people. If we are going to go by all these strategies, protocols that we've been given, we would be able to, or we would overcome. One last thing is, as educators and teachers, we should be able to take care of our own mental health too, so that we can help our children. If we are not strong mentally, we cannot be there for them. So as we prepare to open schools, talk to the children and all that, what about us? We should also work on ourselves. We should be doing breathing in exercises, relaxation techniques, as my other colleagues have said, and we should relax. When something comes up, we should be able to deal with it in a very calm way, that the children will also be fine. I hope and pray that whatever we discussed here, our educators, our teachers, and our students will be able to pick something good out of it, and then we would all be successful as we go through this crisis. Thank you.
Thank you so much, Dr. Oti-Boadi. Thank you, Dr. Tutu-Danquah. Thank you, Dr. Gaisie, for taking time out of your busy schedule to make this very, very insightful and informative. We are so grateful.